let's take a closer look at what triggers white blood cells to multiply and take action. When a cell becomes infected with bacteria or a virus, it releases cytokines, which are chemical signals that alert white blood cells. In response, white blood cells multiply and spring into action to fight off the infection. The body will also produce corticosteroids, a hormone that is made in response to the stress or inflammation caused by the invasion of a microorganism, which also leads to increased white blood cell production. To reach the site of infection, white blood cells leave the bloodstream through a process called diapedesis. Neutrophils, for example, follow chemotactic signals like C5a, a complement protein, leukotrienes, and bacterial byproducts. These signals guide them to the infection site, where they squeeze through the blood vessel walls and enter the affected tissues. Once white blood cells have done their job, they often go through apoptosis or programmed cell death. This controlled process helps prevent excessive inflammation, and macrophages clean up the leftover cells that are no longer needed. Microorganisms entering and infecting the body will trigger a series of events in your body that will help to eliminate the infection.